Good morning, everyone. This is Dr. Deptee Warikoo, Assistant Professor, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Today, I will be taking this lecture on pulmonary function tests. So, first, let us see why these pulmonary function tests are done. These are mainly done to check whether the lung volumes and capacities are normal and whether the functioning of pulmonary system is up to mark. So before that, we should know about the anatomy of lung. Lung comes in the lower respiratory tract where we deal with the airways which go inside the lung and the alveoli structures. The airways, we have conducting zones, transitional zones, and respiratory zones. Conducting zones, no gas exchange occurs, as we all know. Transitional zones, they are alveoli appear to be not in great number, and in respiratory zones they contain the alveoli sacs, which you can see in the diagram as well. We have 23 generations of the airways. So the alveoli are approximately 300 million in our body. There is a lot of diameters and we need them for the gaseous exchange in our body. The mechanism of breathing mainly depends on two things, the inspiration and the expiration. Inspiration is an active process, that means the muscles contract to cause inspiration, while expiration is a passive process. It is done by itself by the pressure changes. So first we talk about the lung volumes. We have 4 volumes and 4 capacities, which you can see in the diagram. So first is the tidal volume. It is the volume of air which is inspired and expired when you are normally breathing. Then you can see this part is the tidal volume. Then we have the inspiratory reserve volume, the maximum amount of air that we can inhale in a normal tidal volume inspiration. This is the inspiratory reserve volume. Then the expiratory reserve volume is the maximum amount of air that can be exhaled from the resting expiratory level. Then residual volume is the volume remaining in the lungs at the end of the maximum air expired. Then we have the vital capacity, the volume of air that can be exhaled from the lungs after a maximum inspiration. Okay, so this is the vital capacity. Then we can see the inspiratory capacity. It is the amount of air that can be inhaled from the end of the tidal volume. There you can see the inspiratory capacity. Now see the functional residual capacity is the remaining air in the lungs at the end of the tidal volume expiration. Here is the functional residual capacity. Then we see the total lung capacity, volume of air in the lungs after a maximum inspiration. This yellow circle is the total lung capacity. Then we need to know about the pulmonary function tests, which mainly evaluate the lung volumes, where the airway function is proper or not, or whether we are doing proper gaseous exchange, the body is doing or not. So when are these tests indicated? If we detect a disease of pulmonary system, if we evaluate extent and monitor course of disease, if we want to evaluate whether our treatment is okay or not, and if we want to measure the effects of exposures and the surgical risk, the procedures of the risks of the surgical procedures. Then pulmonary function tests. So pulmonary function tests are airway function tests and lung volumes in ventilations. So airway function tests are basically done by simple spirometry, forced vital capacity maneuver, maximum voluntary ventilation, maximum inspiratory pressures, and airway resistance. Lung volumes and ventilations are checked by functional residual capacity, total lung capacity, residual volume, minute ventilation, alveolar ventilation, which we also measure the dead space, and distribution of the ventilation. So pulmonary function tests, diffuse capacity tests are there, blood gaseous and gas exchanges and tests are there. Cardiopulmonary exercises tests could be done. We can also perform metabolic measurements where we can see the resting energy exposure and the chemical analysis of exhaled breath. So spirometry is the basic test which we do to measurement the pattern of air movement into and out of the lungs during controlled ventilation maneuvers. The importance is very much because it is an objective evidence in identifying patterns of diseases of pulmonary functions. Lung factors which affect spirometry are mainly the mechanical factors and the resistive elements. Mechanical properties which mainly we have to focus in this pulmonary function testing is the compliance of lung and the elastic recoil of lung. Resistive properties which we need to focus are determined by airway calibers and the affected lung volumes, bronchial smooth muscles or airway functions. Factors which affect lung volumes are age, sex, height, weight, race and disease. So the technique is mainly, first we tell the patient to be seated and then a closed circuit technique is done. Like we place nose clip and then tell the patient to breathe through the mouthpiece and have the patient to take a deep breath as fast as possible. Now tell the patient blow out as hard as he could. So that is how we perform it. So forced vital capacity which we need to check is the total volume of the air that can be exhaled forcefully from the lungs. And forced vital capacity is 80 to 120% if we expire is normal, 70 to 79% expired is mild reduction, 50 to 69% is the moderate reduction and less than 50% is severe reduction. Forced expiratory volume in 1 second, volume of the air that is forcefully expired from full inflation in the first second. We measure it in liters. So again, if it is more than 75%, it is normal. If it is 60 to 75%, then we suspect some mild obstructions. And if it is 50 to 59%, that is moderate obstructions. And less than 49%, we can say that patient is having severe obstructions. Then we have forced expiratory flow, which should be 25 to 75%. That is the forced expiratory flow during the middle half of forced volumes, forced vital capacities. So it is measured in liters per second. So again we see it, if it is more than 60%, it is normal. 40 to 60% is mild obstruction, 20 to 40% is moderate obstruction, and less than 10% is severe obstruction. Then we need to know about the acceptability criteria. Then when is the test good to start? When you are not coughing, no variable flow is there, no early termination, and the reproducibility should be good. So flow loop, volume loop is very important. It illustrates maximum expiratory and inspiratory flow volume curves. It is very useful for when we see whether the diseases are obstructive, restrictive. Okay, so categories, how we categorize lung diseases are whether they can be obstructive, they could be restrictive, or they could be mixed diseases. So what does obstructive disorders show? So obstructive disorders are characterized by a limitation of expiratory airflow. For example, conditions like asthma, chronic obstructive pulmonary diseases. And in spirometry, when we do in these obstructive diseases, what we see is slow rise in upstroke and they may not reach the plateau. The restrictive lung diseases, on the other hand, are characterized by diminished lung volumes. It is mainly due to alteration in the lung parenchyma, or we can say that there are some neuromuscular diseases like muscular dystrophy, whatever could be there. So how they show the graph? They show a rapid upstroke as in normal spirometry and then a plateau volume is low. So large airway obstructions are characterized by a truncated inspiratory or expiratory loop. That is very important, we need to see. So lung volumes are measured through various methods like dilution, helium, 100% oxygen, body. This helium method and 100% oxygen method is a dilutional method which we can, and then body plethysmography could also be used. So there could be changes in these lung volumes in various kinds of diseases, whether there is a normal, we can see the graph there and how it is in normal, how in restrictives, how if there are air trappings, or how if the lungs are hyperventilated. So clinically we could applicate these conditions, all the graphs in various conditions of the spirometry, which you can see in the graphs down. There are various cases. I need you to focus on these and identify what are the cases. And we could discuss them in our classes. I hope you got to know about the illustrations of the spirometry and pulmonary function test. Thank you.